can see the darkening due to the amalgam stain. You can see in the lingual extension there's a little bit of discoloration, and in the mesial portion of the proximal or of the pulpal wall. None of those areas are radiographically or clinically indicative of decay. I'd say as far as you can see the preparation completed, everything's excavated out nicely. The dam is going to keep the tongue and the salivary gland in check so we can do a nice dry adhesive procedure. I want to make sure the internal surface of my cavity is clean and disinfected. So we'll scrub that out a little bit with the cotton pellet saturated with aqua. Materials have been developed which are now 6th and 7th generation adhesives that are self-etching in capability. In other words, the total etch technique or phosphoric acid is not. Take our phosphoric acid. So you see I'm placing the etchant material on the enamel. Okay, I'm going to take the intraoral camera, and you want to physically scrub this material into the tooth structure, because that's the way you're going to get the acidic portion of this material to work to its optimum effect. So you agitate, scrub, move this stuff around. Judging on the depth of the cavity wall, the pulpal floor, it may mean that I just do 2 increments right up to full contour, or I do a first increment building up the pulpal floor to within 2 millimeters of the cavo-surface margin, and then those last 2 increments on the facial and lingual will be contoured to proper occlusal form. Ochre is a basic shade that looks kind of like dentin root color. I'm going to place this in the depth of the grooves to give a little bit of 3-dimensionality to the restoration. So what I'm going to do is I'm going to pick up a little bit of the stain, a little bit of the ochre on the endophile. Now if you're going to do rotary shaping, make sure you're using an anatomically shaped instrument. And I'll show you what I'm going to use here. This diamond is an interproximal finishing diamond. But notice the shape. It's like a needle, or they call it a mosquito. But the shape is concave. That means it's going to impart convexity. I'm moving the point from the restorative material toward the tooth and just along the marginal interface. I don't want to flatten out the anatomic form I've created. I just want to smooth it, just like a paintbrush. Retilting the point into the groove, moving from the restorative material toward the tooth. On posteriors, the cup works nice, as you can draw the cup over the cusp and really refine that margin.